It all started with a young woman who saw that something needed to be done, and did it. This young woman was Florence Nightingale. She was the first in what we recognize as a nurse today. She worked tirelessly to the point of getting sick in the Crimean War in Turkey, while helping the injured in the war. She could be seen walking the wards of the hospital carrying a lamp at night. Over the course of 150 years, nursing has evolved from prostitutes who work off their imprisonment to professionally trained, educated people. Hospitals started to train young women in nursing in the 1870s, basically their cheap workforce. 3 years later, they re-emerged as respectable, trained nurses. In the early 1900s, things started to change. More and more schools were taking on training and the education of future nurses. By the 1960s, more changes began to happen. Not only women were becoming nurses, but so were men. Nurses started to be recognized as professionals and were becoming accepted by doctors as equals. Up until 30 years ago, nurses wore all white uniforms, which included white shoes and white hats. Now our uniforms have changed to scrubs that can be any color, any fabric, and even have pretty prints on them. We also have gotten rid of the hat because they found that it would carry germs from one patient to the other. I am a certified nurse assistant, and we are called nurses in a sense because we do very basic nursing skills such as taking vital signs and helping the nurse with other tasks as well as taking care of people. There are also nurses who have associate degrees, which are considered licensed practical nurses, and they act as the charge nurse primarily in nursing homes. Most nurses today must have a bachelor's degree, and they mostly work in hospitals. There's also the master's degree where a nurse can become a nurse practitioner, and furthermore there is the PhD, of which I don't know much about. In the Civil War there were no nurses, only women who were not trained and would come to help in hopes to see their husbands or other loved ones. In World War I, nurses were officially used at hospitals near the front lines and were commissioned soldiers. Same in World War II as well. During the Vietnam War, nurses were used in MASH units, which were mobile army surgical hospitals, units on the front lines while bombs and mortars were raining down around them. In nursing, things are always changing and being improved. Since 1896, the American Nurses Association, or ANA, has been in existence, and they are there to be sure nurses are treated ethically and with respect, sort of like a union does for labor workers in factories. Mary Mahoney was the first African-American professionally trained nurse in 1879. Up until the 1960s, African-American nurses were trained in segregated hospitals and schools. Even up through the 1970s, there was little to no progress in cooperating blacks with whites together in nursing. Nurses tend to have their own language, such as PRN means as needed, and POQ4H means by mouth every 4 hours, and so many others. We often forget that people don't understand what we are saying, and sometimes can't really explain what we are saying to others. The work is hard. Sometimes dangerous things happen, and you might be treated rudely by a doctor, or fellow nurse, or even a patient. But the good news is that it's always worth it. Helping others is the ultimate goal in nursing, as it should be. The hours are crazy as well. At my job we do 8-hour shifts, but most everywhere else they do 12-hour shifts, and there are a lot of times you miss out on holidays with your family. At nursing, if you get tired of one area, you can always go to another area. There is a never-ending list of things you can do as a nurse. You can work in the emergency room, the operating room, and a nursing home and a patient's home, pediatrics, a doctor's office, a clinic, a disaster area, or out in the mission field. The options are quite endless. The need for nurses is always there, and even right now there is a nursing shortage. Nurses now have to know so much and have to go through continuing education courses or seminars almost every year, or even every few months in order to continue practicing nursing. It's because the field is always changing and improving. With the male nurses, there is a stigmatism about them that they are not manly enough or have what it takes to become a doctor. But really, if they really want to help others, being a nurse is the way to go. Doctors don't give enough time to be personal with their patients because their workload is so enormous. I am proud to be part of the healthcare system, that I can do something for others and possibly help improve the field in some way. We need more compassionate, hardworking people to become nurses to help overcome the nursing shortage. We need people who aren't afraid to get their hands dirty or dive in to help someone in an emergency situation. At the same time, it seems like some people's work ethic needs to be worked on. They might show up for work but don't do their job like they're supposed to, or fall asleep on their shift, or just call in way too much. I am going to school to get my bachelor's degree. I have been called by God to do so, but after that to become an OR nurse to work in the mission field. Even though by then the industry will be severely helped by electronics, I will still need to know how to do things manually and old school because out in the mission field there might not be electricity or modernized equipment. In conclusion, being a nurse is well worth the sacrifice of time away from family and friends. It's worth the pain of going to school and putting so much effort in the fight to help others. After all, helping others is the be-all, end-all for nurses. We long to help others. We won't be satisfied until we see people getting the help they need.